Low back pain affects around 85% of adults at least once in their lives, and that's according to the World Health Organization. In fact, a report they produced back in 2020 tells us that over 619 million people around the world deal with this pain every year. And by 2050, that number could swell to around 843 million people. Now, not just crunching these numbers, this is quite evident in my daily clinical practice as a physiotherapist. About 6 to 7 out of 10 patients that I see in my office usually walking complaining of terrible low back pain, which has been crushing their daily productivity. So let's get into what's really going on with this widespread problem and what we can do to help ourselves to feel better. Now, first things first, what really causes low back pain? One of the main culprits is something we call spondylosis, which is just a fancy term for age-related wear and tear of the spine. This includes changes to the bones in our spine, known as vertebrae, along with the joints and the discs that cushion them. Now, over time, these changes can affect the spine's ability to handle your body weight in space and can cause abnormal loading of spinal joints. And this eventually leads to irritation and significant discomfort in the long run. In some cases, this can lead to small bony growths that we call bone spurs or osteophytes that might press on nearby sensitive structures, especially nerves. Now, let's move on to the next common cause, which is strains and sprains. A strain happens when a muscle or tendon gets stretched or torn. If you remember a bit of your secondary school biology, tendons are those structures that connect your muscles to bones. Now, strains often result from overloading, sudden or quick movements, and repetitive work that places a lot of loading on your spine. On the other hand, a sprain is an injury to a ligament, that tissue that connects bones and helps with stabilizing the joints. Sprains usually happen when we twist or turn suddenly, and they can lead to pain, swelling, and instability within the spinal column in this context. Moving on to another cause of low back pain, we have what is known as herniated discs. A spinal disc is a tough structure that's stuck between two bones and is mainly responsible for cushioning the bones and allowing movement. It consists of a tough outer layer and a soft center with a jelly-like substance. A herniated disc occurs when that soft center pushes through a tear in the outer layer, and this can lead to pressure on nearby nerves and often leads to numbness and pain in your lower back and legs. But that's not the whole story. There are some less common factors that can contribute to low back pain as well. Structural issues like abnormal curvatures of the spine and other issues you may be born with can put extra stress on your spine over time, leading to discomfort. In rare cases, tumors within or around the spine can also lead to pain if they press on spinal structures. And sometimes other conditions like kidney infections or uterine fibroids and sometimes prostate cancer can refer pain to the low back area. So how do we figure out what's going on? In most cases, knowing what's gone wrong with your back starts with a thorough assessment or evaluation by a qualified healthcare practitioner. Now, this could be a doctor or a physiotherapist. This means going over your medical history so that they can understand your pain's nature and potential primary causes. A physical examination often follows, where the responsible professional checks for physical limitations and perform the necessary clinical tests to gain further insight into the condition. Sometimes imaging tests like X-rays, MRIs are needed to get a clearer picture of what's happening. All of this informs a proper treatment plan that may last for one day, a few days, or a longer period, depending on the nature and the severity of the condition. We'll talk about the key treatment options in our next video on treating low back pain in a bit more detail. If you found this information helpful, give this video a thumbs up, follow us, and drop your thoughts in the comments section. If you have some more personal questions or simply want to chat in greater detail, feel free to send a private message and let's keep the conversation going on how we can tackle this common issue together. Until next time, take care.